Hello everybody, I'm Dr. Yan Yu, founder of the Calgary Guide to Understanding Disease. For those new to these videos, welcome to the Calgary Guide Video Series. For those returning viewers, welcome back. Today we're going to be talking about the pathogenesis of type 2 diabetes mellitus. Know that you can help support us in our work by liking the video just as it's starting out and by subscribing to my channel. Now with that said, let's get started. There's many causes of type 2 diabetes, but it starts with an unhealthy lifestyle. Overeating, obesity, inactivity. What the unhealthy lifestyle leads to is the intraperitoneal cavity accumulating with visceral fat, also known as abdominal fat. Now this abdominal fat is actually an endocrine organ that secretes inflammatory mediators, adipokines, and free fatty acids. Note that adipokines are simply inflammatory mediators released from adipose tissue, such as TNF-alpha. The more adipose tissue a patient has, the more adipokines are released. Now this combination of inflammatory mediators, adipokines, and free fatty acids act on the body tissue with complex and as yet unclear mechanisms, one of which includes lipotoxicity, which is where free fatty acids inhibit the function of GLUT2 transporters on beta cells of the pancreas, which reduces glucose import. The other contributor to the pathogenesis of type 2 diabetes are as follows. Genetic susceptibility. Some patients have polygenetic or monogenetic factors, such as maturity-onset diabetes of the young, otherwise known as MODY, which can predispose insulin resistance. Another factor is aging. With age, the beta cell mass declines, and so those predisposed to insulin resistance may develop type 2 diabetes as they age. Lastly, some medications might precipitate type 2 diabetes, such as corticosteroids, antipsychotics, highly active antiretrovirals, or progesterone-only oral contraceptives. The combination of genetic susceptibility, aging, and medications, as well as the complex and unclear mechanisms due to the combination of inflammatory mediators, adipokines, and free fatty acids, they all contribute to a phenomenon known as insulin resistance, which is a condition where the liver, muscle, and adipose tissues become less responsive to insulin and thus are less able to use glucose as a fuel source. Initially, the beta cells of the pancreas work overtime to increase insulin secretion to combat this insulin resistance on the part of other body cells. In that way, the excess insulin keeps the blood glucose concentration normal. However, over many years, as insulin resistance in the rest of the body worsens, the beta cells of the pancreas tire out, and as a result, secrete less insulin. That's known as a relative insulin deficiency because some insulin is still produced, just less so. What that results in, because there's less insulin to transport blood glucose into body cells, is more blood glucose remains in the blood, otherwise known as hyperglycemia. It turns out that high blood sugar levels can be directly toxic to beta cells of the pancreas, worsening beta cell function and contributing to further reducing insulin secretion. Now, of course, lipotoxicity, which is where free fatty acids released by abdominal fat inhibit the function of GLUT2 transporters on beta cells, reducing glucose import, resulting in beta cells not recognizing high blood glucose and thus reducing insulin secretion. That process of lipotoxicity can also worsen beta cell function, reducing insulin secretion. Now, in this state of insulin resistance, since body cells can't use the glucose, the body perceives a state of starvation, mobilizing triglycerides into breaking down, releasing more free fatty acids, because remember, a triglyceride is just a glycerol molecule plus 3 fatty acids, so that the cells can use the free fatty acids as fuel. Unfortunately, of course, that then worsens the process of lipotoxicity. Now going back to the rest of the flowchart, over many more years, the beta cells of the pancreas deteriorate until they finally stop producing insulin. That's a condition known as the absolute insulin deficit. Now in this condition, of course, there is still hyperglycemia because there's not enough insulin to bring down blood sugar levels. There's also, of course, the body's perceived state of starvation, leading to more free fatty acid production, worsening the process of lipotoxicity. And so you can see the pathogenesis of type 2 diabetes involves multiple and as yet unclear pathways, but multiple downward spirals of pathology, which all contribute to type 2 diabetes. That's all for today, folks. Thank you for your attention. Again, if you have thoughts about the order in which I should present the slides, please let me know. As well, if you have any comments about the scientific and medical information presented in the slides, I'd love to hear from you. Just leave a comment down below. Once again, Please support us in our work by liking the video and subscribing to my channel. Thanks, and we'll see you in the next video.